So for those of you that are new, my name is Joy Barnes. I'm the Overdose Fatality Review Coordinator for the Baltimore City Health Department. And it is my pleasure to reintroduce to you the Director of Opioid Overdose Prevention at the Baltimore City Health Department as we get into the second part of our event. So please give it up for Brittany Spencer, Director of Opioid Overdose.
Hello, everybody. Thank you so much for everybody that has come here today. Again, as Joy said, my name is Brittany Spencer. I'm the Director of Opioid Overdose Prevention at the Baltimore City Health Department. And we just want to thank everybody that is here just to listen. Especially also thank you to Red Emma's for hosting this event, as well as all of our amazing vendors. Please do not sleep on those vendors. They are amazing. They offer great resources. They are all downstairs. Please check them out before you leave here today. In recent years, the overdose crisis has posed significant challenges, but it has also galvanized us to respond with compassion, innovation, and renewed commitment to our neighbors. The severity of the crisis is a call to action, a reminder that we have power to make a difference. There are many organizations, many right here in this building, whether they're represented by the vendors downstairs or some of our wonderful people right in front of me from from BHRC. Sorry, I saw the Be More Power hat. It just threw me off. And Bridges. They're all doing such amazing and impactful work each and every day. The Baltimore City Health Department is also dedicated to addressing this crisis through a multifaceted approach. Saving lives in the lock zone, ensuring access to treatment, fighting stigma through education and training, designing educational programming for prevention, and utilizing data and trends to inform health strategies. The opioid epidemic is unprecedented, and our response needs to be unprecedented as well. Traditional strategies alone are not going to decrease the number of fatal and non-fatal overdoses. I'd like to highlight some of the initiatives spearheaded by the health department, one such as Healthcare on the Spot. On your way here, you may have seen a very large van on Greenmount Ave with the logo, The Spot, on it. That is a partnership between, a collaborative venture between the health department and Johns Hopkins University. This is a program that offers free, low-barrier healthcare services that encompass vital areas like buprenorphine administration, wound care, STI testing and treatment, and more. In conjunction with the health department, BHSB also introduced the KOD Kids Off Drugs series in 2021, and we've engaged over 500 young adults across multiple schools and universities in Baltimore City. These efforts, however, are only the beginning. Our dedication to combating the opioid crisis is unwavering, and our commitment to crafting innovative, holistic solutions remain resolute. By joining forces and embracing novel strategies, we can usher in positive change, ultimately steering our community towards a brighter and healthier future. Baltimore City has leadership at all levels that are committed to combating the opioid crisis. So it is my honor to introduce our next speaker. Born and raised in Baltimore, this leader has made combating the opioid crisis a top priority, and he is dedicated to fighting this issue through compassionate and evidence-based means. His administration works tirelessly so that communities have a chance to thrive. Please join me in welcoming Mayor of Baltimore City, Brandon Scott.
Sure. Good afternoon, everyone. Good afternoon, Shorty. Welcome, everyone, to the 8th Annual International Overdose Awareness Day hosted by the Baltimore City Health Department. I came here today for a few reasons. First, I want to truly thank each and every one of you, not only for being here today, partaking in the discussions, learning more about what you all can do to help save lives and signing up for services that we have downstairs, but also to thank everybody in this room who does that work each and every day to keep our neighbors alive. So give yourselves a big round of applause. Because we know just how important that work is. We observe International Overdose Awareness Day each year on August 31st to honor the lives of those that we lost, who we love. In the last 2 years in Baltimore, we've lost almost 2,000 of our neighbors to overdose, right? 2,000. That, as you know, trumps gun violence. But very rarely do you hear anyone talking about the neighbors that we lose to overdose. And we all know why that is. We have to continue to call out those who continue to think of folks with addiction issues and other things as less than them, because they are our neighbors. They are the people living next to us. They are our family members, and we have to support them in every way that we can. As someone who saw firsthand what it can do and how overdose can wreck a family and cause trauma for generations, I want to extend my sincere condolences to the families impacted by overdose deaths here in Baltimore. And that's why I also want to again thank each and every one of you for working diligently to combat the opioid crisis and overdose crisis here in Baltimore. From our mental health providers to legal support to peer recovery specialists. I'm going to say that one again. Peer recovery specialists, treatment providers, hospitals, social service workers, to our public safety officers, and so many more. Thank you. Your work helps make and helps the residents of Baltimore healthier and safer. Saving lives today gives people the opportunity and the option to make better choices tomorrow. Today, you've already heard from several professionals about grief and loss, and later there will be another significant and fruitful discussion on youth and the opioid crisis. I hope that you leave this event today with more knowledge and resources to share with your clients or your loved ones or just the person next door. And I hope that you're empowered to be advocates for overdose awareness and prevention. And since everyone probably know what I'm about to say next, and that means that you have to be with us as we advocate for overdose prevention sites in Baltimore. There are many ways that you can do your part. You can lock prescriptions up. You can carry naloxone or call 911 when you see someone overdosing. You can do all of that. But as we move forward into a phase where we want to have significant policy change that has been proven in place after place after place around this world to save lives, we're going to need everyone in the fight as we bring overdose prevention sites here to Baltimore. So I want to say thank you for the time today. Thank you for your great support. Thank you to Councilwoman McCray and Councilwoman Ramos for always being here and leading on this effort as well. And thank you, everybody. Please have a great day. But the fight is just beginning. Thank you.
Thank you so much, Mayor Scott. Next, I would like to bring up our acting commissioner, Mary Beth Holler.
Thank you. Good afternoon, everyone. And thank you for being here today as we gather to recognize International Opioid Awareness Day. In doing so, we honor the lives of the community members that we have lost. We uplift the lives of our loved ones who are still living with substance use disorder, and we offer support to their caregivers. The opioid epidemic has devastated far too many lives and families here in Baltimore and across the country, and this issue impacts all of us. I would like to thank our partners at Red Emma's for being servant leaders, for using Narcan when necessary, providing space, this wonderful space, to hold important conversations like this one, and being a staple in the Greenmount community. I would also like to thank our partners who have made this event possible, including several of our Baltimore City Health Department teams, several mayor's offices, including the Office of Neighborhood Safety and Engagement, the Mayor's Office of Employment Development, and the Mayor's Office of Homeless Services. I would like to thank Johns Hopkins, Behavioral Health System Baltimore, Be More Power, Young People in Recovery, NAMI Baltimore, Charm City Care Connection, Maryland Food Bank, and many others. The Baltimore City Health Department hosts events like this one to provide resources and strategies directly to communities impacted by the crisis. Our goal is to empower each citizen with the tools to live healthier lives each day. Overdose Awareness Day is just one designated day, but for us, it's every day. Please make sure to visit our vendors downstairs. In speaking with them, you will know the passion they bring to this issue. Thank you.
Thank you so much, Mary Beth. I would now like to bring up Councilwoman McCray.
Good afternoon, everyone. It's a great privilege to be in community with you all for Baltimore's annual observance of International Overdose Awareness Day. We know that the exacerbated prevalence of substance misuse, opioid overdose, and intoxication-related deaths is often the number one closeted and concealed nationwide epidemic. We also know that this epidemic knows no bounds, plaguing all identity groups and geographic areas. And Baltimore City has not been immune. Between 2013 and 2020, our city saw a 318% increase in fatal overdoses. It's imperative that we see substance misuse as a chronic disease. This should be treated like any other chronic disease. We all know that it's something that we cannot police ourselves out of, and it has to be treated like like the public health crisis that it is. Decades of criminalizing, silencing, and stigmatizing those who misuse opioids has pushed our most vulnerable populations into the shadows. Those are folks that we all know, folks within our families, our friends. And when we do that, we create an unsafe ecosystem where individuals have no choice but to undertake riskier behaviors and suffer in silence, increasing their chances of falling victim to this disease. We also know that the overwhelming presence of fentanyl in the U.S. has led to a 7,500% increase in fentanyl-related deaths, and 92% of all illicit drugs in Baltimore City have fentanyl within them. 89% of the loved ones that we lost to this disease in 2020 were fentanyl-related overdoses. And having that knowledge is more important than ever to destigmatize opioid use and provide extensive and progressive resources like our mayor stated earlier, opioid prevention sites, which I want to say I 2,000% support. We need every resource so we can make sure that we're spreading information, that we're helping folks and providing awareness to ultimately prevent the unnecessary tragedy of overdose deaths. And I'm proud that through collaboration between our city agencies, our local organizations, and our community partners, that we are taking critical steps towards enhancing our community harm reduction programs and initiatives. We know that through that work, Baltimore City has been operating mobile crisis services, needle exchange programs, stabilization centers, as well as many other critical services. And our health department also established the Baltimore City Opioid Intervention Team with the immediate purpose of implementing a coordinated response to address this crisis. And we thank you. As the chair of the Health, Environment, and Technology Committee, I stand committed to work with all of our stakeholders, my folks I see back there and around the room, to bolster effective harm reduction strategies and pass targeted policies to combat the opioid crisis. My committee has held recurring hearings to analyze data, identify intersectional patterns, and evaluate the effectiveness of our current strategies in order to curate innovative solutions and dispel current trends. And ultimately, we cannot forget that substance misuse and overdoses are preventable, treatment exists, and recovery is possible. Again, for our family, our friends, our neighbors. I'm so thankful to be here, and I thank you all for being here as well. Thank you for your time.
Thank you so much, Councilwoman. Thank you for always supporting us. You show up every single year, and we can't thank you enough. Thank you. And now I would like to introduce the Councilwoman for this district, District 14, Councilwoman Ramos.
Good afternoon, everyone. Good afternoon. Welcome to the fabulous 14th District. Yes. And thank you for bringing this event here to our district. Thank you so much. I also want to thank Red Emma's for hosting us, being an awesome host. Yes, Red Emma's. And I thank them every day for choosing Greenmount Avenue for their new location and their permanent home. They bought this building. Yes, yes. And I want to thank all of you. You have been in this fight forever. You're helping people every day make sure that they get the services and the help that they need. You're in this fight forever to advocate for better services. And there is more to do. These types of events are important to celebrate what we've done, but to acknowledge still the work to be done, right? And we actually have an opportunity coming up that you all have probably already talked about, which is the opioid settlement funds. Baltimore did not participate in the opioid settlement with the state. And the reason is because we think we got much harder hit, right, in terms of the crisis and deserve more, right? So we potentially could have a lot more funding to be able to continue this work, but to think better about how we can establish a much better system to help people in substance abuse, right? This is a real opportunity that I think is very exciting. And all of you have been in the work, so I bet you all have the best ideas for how to make sure that we have a system that's actually going to serve people who need it most. And as the councilwoman knows, my work has mostly been around making sure that people have good, stable housing. And that, thank you. And that is actually part of the puzzle, right? That is part of the puzzle. And so I just want to let you know I'm completely and totally with you. I think this is amazing work that you're doing, and that we have the opportunity to work together to come up with a system that's actually going to be continuing the work and doing what we can to make sure that we get that overdose level way down, that people don't die. That's what we're here for. And so I'm grateful to be part of this, and thank you for inviting me. And again, thank you for all of your incredible, incredible work. Thank you so much.
Thank you, Councilwoman Ramos. We're very excited to bring Overdose Awareness Day to the 14th District this year. So to close us out today, I am going to bring up Cicely Franklin with the Baltimore City Health Department's Community Risk Reduction Program.
Let me again welcome everyone here to our 2023 Overdose Awareness Day celebration. It is an extreme pleasure. I will stop there. It is an extreme pleasure to be before you on this awesome and super important occasion. Again, my name is Cicely Franklin, and I am part of the Baltimore City Health Department Community Risk Reduction Services Program. Most everybody know us as the Needle Exchange Program. And we are under the umbrella in the Health Department of Population Health and Disease Prevention. Many people do not know that we are an HIV prevention program and a harm reduction program. Our program is led by Derek Hunt, Jeffrey Long, and Rania Mohammed. Our program offers drug treatment referrals and resources, syringe exchange to individuals who intravenously use illicit drugs, safe syringe disposal training and overdose response prevention training, naloxone distribution, fentanyl and xylazine test strips distribution, as well as reproductive health services and resources. You'll see us on the block on Thursday nights, the first and the third Thursdays, where you can get reproductive health services that we offer. We work in this community daily, and we witness the impact that overdose response prevention training has on those who struggle with addiction. It is our responsibility to provide exceptional outreach services to our communities. We are our brothers and sisters keepers. As I close, I want to extend my sincere condolences to those individuals we have lost due to an overdose this past year and many years before that. It's super important that we acknowledge them. Let's continue to do good work and be a great example of what community really looks like. Thank you.
Give it up one more time for Cicely and all of our other presenters today. Because we would not be able to do all of the good work that we do at the Baltimore City Health Department without you, community, without our council people and the city's and the mayor's office kind of standing behind us with this work. And so I will also be presenting our proclamation for the 2023 year, designating today as International Overdose Awareness Day. Whereas the Health Commissioner of Baltimore City has declared drug and alcohol overdose as a public health emergency spanning across the entire city. And whereas Baltimore City has lost over 6,500 lives to overdose since 2011, and whereas over 1,000 overdose deaths occurred in Baltimore City in 2021, and whereas more than 2,700 non-fatal overdoses occurred in Baltimore City in 2022, and whereas more than 25,000 of Baltimore City residents suffer from substance use disorder, and whereas the condition of addiction influences factors that shape health outcomes, potentially reducing life expectancy and overall well-being of residents in Baltimore City, and whereas the Baltimore City strategy to address opioid addiction and overdose is founded upon a 4-pillar framework, including prevention and education, access to naloxone, with a trauma-informed approach. And whereas healthcare providers, individuals at high risk, families, friends, neighbors, have the potential to rescue lives by familiarizing themselves with the indicators of overdose and acquiring the knowledge to administer Narcan. Whereas International Overdose Awareness Day also aims to extend a message of encouragement and optimism to the loved ones of individuals grappling with substance use disorder, as well as to those who are currently or have previously experienced a substance use challenge. Therefore, Mayor Brandon Scott hereby proclaimed that August 31st, 2023 is International Overdose Awareness Day in Baltimore City, and welcomes everyone to join in this observation. Thank you all so much.